Cervical cancer is caused by the human papilloma virus HPV passed from one person to another during sex. Among other risk factors causing cervical cancer in Kenya are low socioeconomic status, smoking, multiple sex partners, and multiple childbirths. It is the most common female reproductive cancer after breast cancer, with 84% of the cases in developing countries. According to statistics from World Health Organization 2020, more than 600,000 women were diagnosed with cervical cancer, with over 300 deaths.
Unfortunately, when one has cancer, depending on the stage, the chances of you going much earlier is higher, and that is why we recommend that if you have cancer, you go for treatment.
Currently, the estimates indicate that every year, 5,236 women are diagnosed with cervical cancer and 3,211 are dying from it. Non-empirical observations also indicate that Meru region of Kenya has one of the most highest cases of cervical cancer in the country. Mercy Wambui was diagnosed with cervical cancer in 2017, and since then, things were never the same. According to another survivor, Lucy Atenyo, several misdiagnoses were made before eventually realizing she had cervical cancer.
Kwa tu na celebrate hiyo siku, exam ilitoka ya mtoto wangu. Sasa nikaanza, beleni nilikuwa nimeanza kubleed, lakini nikienda hosi, nilikuwa naambiwa ati ni hormones zina change.
Done. The results came out. And the results came out that the cervical cancer was in stage 1. I waited for 2 weeks. Unfortunately, the pathology results came back that the cervical cancer had spread to my lymph nodes, and so I needed to do radiotherapy.
Dr. Catherine Nyongesa, an oncologist, says there are newer methods of treating cervical cancer called immunotherapy, which are very expensive as compared to the conventional chemotherapy. She says that on average, by the time a patient reaches an oncologist, they have spent around hundreds of thousands.
We have newer methods of treating cancer. We call them immunotherapy, and immunotherapy is even more costly than just the conventional chemotherapy. I can quote, there's a study which was done some time back, and it showed that on average, a cancer patient, if you look through that journey, up to the time they even reach the oncologist and get treatment, it can cost in hundreds of thousands.
A considerable proportion of young women in Kenya are, however, unaware of cervical cancer, which is associated with a variety of social and psychological factors. Among the signs and symptoms of cervical cancer are bleeding during and after intercourse, bleeding between periods or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul smell, and persistent back, leg, or pelvic pain. Among the preventive measures of the vaginal cancer are regular screening and getting the HPV vaccine. It has become one of the most killer diseases in the country, threatening many lives, especially in women. The HPV vaccination is the most effective way of controlling cervical cancer, and it's now available free of charge in all government facilities. Reporting for Tandao TV, my name is Emma Simeyo.